In DC, for DC. DC Radio, 96.3 HD4 and DCRadio.gov.
To insideSTYLE, DCRadio.gov, 96.3 HD4. I'm your host, George Worrell. Thank you for tuning in today. I have the pleasure of introducing and welcoming to insideSTYLE President and Chief Executive Officer of Unity Healthcare, Dr. Jessica Boyd. Dr. Boyd, welcome to insideSTYLE. Thank you for coming. How are you today?
I am doing great, George. Thank you so much for having me. I'm excited to have this conversation today.
Yeah, and you know, it's so wonderful that we are going to talk about health and fashion, which I think go hand in hand, because you can't look fabulous and not in good health. And I just think, you know, coming out of, you know, the pandemic and all of the things that are going on now, your voice should be heard. So tell us a little bit about you, you know, before, like, where are you from?
So I'm actually from the Washington, D.C. area.
Ah.
I grew up, though, in Northern Virginia, in Vienna, Virginia.
Okay.
My parents grew up in D.C. They met at McKinley High School, and so we sort of settled in the area. So
Okay.
I grew up around here.
Okay.
I was an avid soccer player and went off to college and played soccer in college, and then knew I wanted to be a doctor from the time I was about 8 years old.
Really?
So set on that journey pretty early in life,
Okay.
and that took me away. And I actually went to medical school and did my fellowship and residency in St. Louis, Missouri. So
okay.
I lived there for several years before moving back to Baltimore,
Okay.
where I really focused on community health there and worked in Baltimore for about 7 years before coming back
Okay.
to the district and working with a management consulting firm, McKinsey and Company, and working with the Cystic Fibrosis Foundation before I landed at Unity Healthcare as its chief medical officer before becoming CEO last year.
That is amazing. And I was at where you were being welcomed, and when you walked up, I was like, this is such a young woman coming out. I was like, this is amazing. So how was that journey from, from college to your first job, and how was that journey just maneuvering through what would ultimately be your job that you have now? How was that?
I mean, I think it was challenging, and it was a windy road. And I think it's really important because, at the time I was 8, I knew I wanted to be a doctor. But I never really saw this future exactly, and I was just willing to go where my path led me and, pay attention to the skills and capabilities I was building along the way and really keep that on my ultimate goal, which has always been around health equity. It's always been reducing health disparities and then just serving in whatever capacity that I could.
So those disparities, are you talking about seeing it like in the Black community and different
Absolutely. My focus has been in the Black community because I identify as African American. And even from the time I was in college, I was doing mentoring programs to reduce violence in some of the neighborhoods in Boston, and really looking at how to disrupt and prevent violence, even from that age, and recognize that violence is a public health crisis. When I was in medical school, I was very involved in sickle cell disease, which is a disease that disproportionately affects African Americans. And when you look at the research dollars that are designated for sickle cell versus other rare diseases, and we were always on the low end, and often doing for ourselves. And so I spent a lot of time doing bone marrow drives, trying to help get African Americans understand the importance of donating bone marrow because children with sickle cell disease were less likely to find a match. So things like that, I've been able to sort of get involved in the community all along my career, and it really solidified my interests.
What do you think the fear is in our community about going to the doctor, getting checkups, all of those things? There's definitely a fear. What do you think that is?
I mean, from my experience, the fear is generational and multi-generational, and it really goes back to, I think there were times when we were abused within the medical system and some of that mistrust. And I know the Tuskegee syphilis study is the one that's most often quoted, but it wasn't a single case. It was something that was happening pervasively, and it was a common experience. And I think, so much that I've heard through the anti-racism movement, it's about really recognizing what the impact of racism has been and what it still is. And I think, that if you're treated differently in a place that you need trust and you need to be able to be vulnerable to address your health issues, if you didn't have that, I think that's where the fear comes from.
Okay.
We definitely see studies, and in my own experience, where when people can go to a place where they do have the trust, when they maybe have providers or team members who look like them and can understand some of their experiences without needing so much explanation, you can see people become comfortable. They can come and rest, and they can bring their full selves into that space and really have a chance at improving their health journey.
And that's good. And it's also good to have a doctor or someone in the field that you're talking to that you trust that will explain it to you. Like, my primary doctor is Dr. Swartz, who I absolutely love. And she takes the time to explain something. Any question that I may have, she takes the time to explain it. And she doesn't make me feel like, oh, you should know this, or just listen to what I say. You don't need to have this explained to you. That's important too, to have that.
You're raising this really important relationship between a patient and their provider and their care team. And some providers will put trust and relationship first. And really recognize a patient's journey and walk with them on it and help them to co-produce care. And I think historically it's been very patriarchal. You go to the doctor, they tell you what to do, you follow those orders. But we've learned over time that's not what works, right? Understanding is what works, partnership. I love when my patients are like, I know, Dr. Boyd, that you want me to take this medicine, but I just can't because my life is chaotic and this time that you want me to do it doesn't work. And then I'm like, okay, well, let's think about it. Can we shift the time? Can we try a different medicine? I mean, it's about partnership.
Yeah, because the ultimate goal is for you to get better.
Absolutely. And self-management is so important. I think recognizing people's autonomy in their own healthcare is also really critical, and giving them that respect.
And knowing your body. Dr. Swartz says to me, you know your body. I know my body. I don't know if there is anybody out there. Like, going through the pandemic was the most scariest time in my life. And there were things that happened. I talk about this publicly, that I went through all of these phases. I thought I was going to die, like on a daily basis. Anxiety. I've never had anxiety. And between Dr. Swartz and my therapist, Deborah, I say that they saved my life because I was able to talk to them about things that were real to me in feeling and in mind. So it helped minimize. I mean, I remember I was going to the hospital and to the doc every time, like, it's my shoulder. That's how bad it was.
Yeah.
And, you see people dying and all. I didn't have the fear of going to the doctor. I had the fear of not going or not making it. So, things are a little different now. Tell me, how did your personal experience, what did you bring from your personal experience to the job that you have now?
I would say my passion for the work, probably first and foremost. Most people would say, I love what I do. And I'm an introvert myself. So I actually love being with a patient and hearing their journey, and even being willing to share a piece of what I have with them and creating that connection. And so I think to this role, like I bring my love of medicine, I bring my connection to patients to an administrative role, right? I do see patients, but that's once a week. I spend most of my time in meetings. I spend most of my time thinking at this big picture about how can we take care of our individual patients and make sure that they are respected and they have the best healthcare that they can get. And then also, we take on this huge responsibility at Unity. We serve about 100,000 patients in the district. So we spend a lot of time thinking, how do we improve health equity for the entire city? And what partnerships does that mean? And what resources do we need to bring? I also think we are part of the voice of the people we serve, and helping to make sure that their stories are told and that we are understanding what their needs are, so that we're making good decisions and sharing information and helping others understand. Like, I take that role really seriously.
So, and that's coming to my next question, is like, how was that process of you deciding, I know you probably have a team, but ultimately the leader is the person that gathers the information. How is that process? How do you do that process of thinking, this needs to happen, like you're passionate about? How do you think about that? What's that process?
I think in a few ways. One, I have been doing the work for a while, so I sort of have built up a little bit of gut and intuition and vision and sort of know where we're going. But I 100% agree. It takes a team. And I love that when I first became CEO, we were having these strategic discussions. We were listening to the community. Our executive leadership team was coming in, talking about ideas. We were really crafting that shared purpose behind the vision. We brought in our board of directors, George, of which you're a member, to really help us think about what are the things that we need to be tackling. And then I am an analytical person, so it's putting all these pieces together. It's really spending the time with your team to think about, what are we trying to achieve? What are those levers that are going to really move the needle? And how do we get this done? And so when it comes to decision making, I think listening is like the number one thing to do. And then two, taking time to reflect and really pull those pieces together into something that works, and then be able to sit with it intuitively and make sure that it makes sense.
Are you able to partner all the things that you do with your closet, meaning
oh my goodness,
going in and like, okay, I have a business meeting today, or I have to see patients today, how do you juggle that?
I think that's a great question. And my day-to-day could be any number of things. I could be in the boardroom, I could be with patients in the exam room, and there are a few things that I try to do. One is be able to interchange comfortable and flexible with a little structure. So I might wear a dress. So if you're a pediatrician, cotton is very important. Like there's some washable things. And they're making some really nice fabrics now that look professional but are still easy to clean. But I want the kids to be able to hug me and touch me and be close to me, right? And so being very accessible in that clothing, but then being able to switch out for a structured blazer for a board meeting is also really important. So I try to have a very interchangeable wardrobe so I can be down on the ground with the kid playing one day, but also professionally engaging some of my peers in that conversation.
Do you have time to go out shopping, or do you do online, or do you do both? Or
I do a little bit of both. I'd say since the pandemic, I've been predominantly online, but I think some of that pre-work sort of helps you kind of know what works for your
body type,
what kind of works for the style of work you're doing, and so I leaned very heavily on that. And I fall somewhere. If I were to describe my style, I try to stay pretty classic and classy with a little chic.
Okay, Dr. Boyd. Okay.
I mean, you gotta have a nice pair of shoes.
And it's timeless. So
yes,
what we tell clients is that who wants to run out every other week?
Absolutely.
You want to build things in your wardrobe that you can have for a time and that are not trendy.
Yeah.
You can have some pieces, but trend is not a word that I really like. I mean, because it can go in and out. When you're buying traditional pieces that you will have, like my Gucci loafers.
Yeah.
I have Gucci loafers from 20 years ago.
Absolutely. Timeless.
And you don't know when, if people follow it, they were like, oh, those are vintage or whatever. But the
I love
style,
vintage.
yeah, I do.
There's nothing wrong with vintage,
but the style
George.
doesn't change.
Yes.
So, and it's an investment.
And I think when you're really busy, that is critical because you want to be able to go and know that the staples within your wardrobe are really going to take you wherever you need to go. And if I'm honest, I talked about that whole path, but I spent a lot of my developmental years studying and working and thinking about how I wanted to change the world. And so I didn't get to spend a lot of time thinking about fashion, right? I will say, for better or worse, I grew up in a household where my parents recognized if you're a young African American trying to be successful, how you looked really mattered. And so my parents really always wanted us to dress very professionally. So I wasn't even allowed to wear jeans until I was 18 years old.
Okay.
So basically when I went to college.
Yeah, then you could. Yeah,
because they didn't want us to be typecast or anything.
Okay.
But that meant that I was sort of always learning how to make sure I could be presentable and interchangeable and do all those switching of environments and just to then be myself in that space.
Do you get a chance to travel?
Yes, I love to travel.
Where's the last place you were?
I was at Costa Rica recently. I've been around the U.S. lately, and I just went to the Turks and Caicos Islands with my family.
So what do you take out of that, aside from just relaxation? And what is your take when you bring back? Is there something that you see and the people that you meet that...
Well, I've been going to the islands or tropical areas because I really need the break. Okay. But like Costa Rica, for example, Pura Vida. I mean, I think that what they bring in their life and their culture is a levity and a joy, and even in the Turks and Caicos, some color, some flavor. And I think, after years in the pandemic and really doing some serious work and working on serious problems, I think remembering that balance. And I always believe that you should bring some of that light into the work that you do every day. So it sort of reminds me, like, yeah, this stuff is serious, but life also needs to be fun. Work can be fun. The work that we're doing is energizing, and I'm passionate about it. So it sort of energizes me, revitalizes me from the inside, and I love all the colors.
All the colors, and then interacting with the people and seeing how their lives are and how it compares to what our lives are here.
Absolutely. I would also say in the work that I do, which is really serving under-resourced communities, it reminds you that, like, we often say, oh, if their healthcare system is different in this small country, this could happen. But many of our patients also don't have access to care. And so I'm always looking at how are they approaching this issue of access. People may be traveling from far, and how can I apply that to my patients, where people think that it's only 2 or 3 miles away, but the distance is actually much greater than that. Like, how much effort it takes to get somewhere is really important. What is the environment in which you're traversing? So I say a mile in DC is not equitable. And so
depending where you are,
Absolutely. Right. So I mean, I think we are so fortunate in this country, and we have so many things, but the disparities that exist, zip code to zip code, block to block, are real. And I always need to keep my mind focused on that and making sure we are designing and creating and innovating at the level that best serves everyone.
And what are your thoughts about diet and your food being like a major part and having access to quality food?
Yeah, I think that's a great point. I mean, food and what you put into your body, and also access to healthy and clean water, right? Those are the things that keep your body running well. I was talking with some of my colleagues about what do the food resources look like in the communities that we're serving. And a convenience store is not the same as a farmer's market, which is not the same as having a butcher or having clean and healthy meats without all of the additives in them.
Yeah.
And, it's quite expensive.
It's very expensive to eat well. It's really expensive.
And then you add on, I mean, I'm busy, and I'm like, I don't have time to cook, right? But many of my patients have the same experience, right? They are juggling families and jobs and things, and it's also, so how do we have things set up where people can lead those really healthy lives, have access to food? We're really excited to be exploring partnerships with others in the district to think about how can we bring those food resources to our patients. And as a healthcare provider, I may not be the expert in food. I know how important it is. I know that social determinants like access to food are 80% of outcomes. So it's imperative for us to find the partners who know about that work and do it, so that we can both serve our community. And so that's a lot of the work we're doing right now.
And I think coming out of the pandemic, everybody, including me, gained weight. Like, so during the pandemic, I just mastered all of my cooking, baking. I was making cakes and pies and frying chicken and all of these comfort things. And, I've always been, maybe 150, and I went to 170.
Yeah.
And that was unheard of, on somebody small, that 20 pounds is 20 pounds. And then just coming back slowly to be able to say, okay, you can't have that. You must minimize. What are your suggestions? Because I know you're a pediatrician, but still overall, it just comes together about what we should be doing.
It's true. And I would say, I faced the same issues. And for me, it really came to thinking about how do all the pieces fit together. So stability and weight, it is about food, and it's about making good food choices. it's also about making sure you're moving throughout the day. It's exercise, but it's not just exercise. It's walking that little bit all of the time. And it's also about stress and mindset and where we are. And I found for myself, stress levels were really high. It was affecting my sleep, which is also really important in weight management. And I think it's thinking about the big picture. So like, yes, it is the food and making sure we're making healthy choices. But that's not the only component. And so I think it's taking that holistic approach.
How hard was it for you during the pandemic? Because we, as patients, we knew how. But for the provider, the person that we have to come see, how did you deal with that?
Well, I'd like to talk about it from a couple of perspectives.
Please.
When the pandemic hit, I was the chief medical officer of the organization. So I was a provider, but I still spend most of my time in meetings. And so I think the frontline providers that I serve and work with, there was both pride and anxiety and fear and love all mixed together. And it was a really complicated mix of emotions. Many of us were like, well, we were trained to do this and really put ourselves out there to serve, which for a period of time, we had adrenaline. It was exhilarating, but it became tiring. So I know my team, like my providers, are exhausted because the pandemic, it really didn't come to this discrete end. It's kind of still out there.
Yeah, that's true. Yeah.
But then we also were like, okay, wait, we need to think about the bigger picture of our health. So I think it really was an exhausting time. As the leader, I think I had a component of that, but felt a really strong sense of responsibility to my team and to the patients for us to be always doing more to serve. I think many of us were really struck by the early disparity in COVID care. We were finding that our patients were dying at a higher rate. They were dying younger. There were higher rates of infectivity. And for those of us who do this work, we were like, not on my watch. Like, we're diving into this fight. And I think that's a lot of responsibility. So I agree. It was a stressful time, but I appreciate my team. I think a lot of us were in it together. And I think that was important within healthcare, but I think there was also general support from the rest of the community. I would say I had neighbors, I had friends, I had family who were all like, what do you need? Because we were pulling, 20-hour days.
20-hour days.
And I used to say, okay, we're spending so much time, but I can't go to the grocery store because I'm working like 20 hours. And it was a risk. But my brother-in-law, he put on the gloves. Those were back in the days. He put on the he would grocery shop for me, wipe them down. And I think family and community are just so important. And it's like how we come together and support one another.
And I think out of it, we became closer because I've always been close to my parents. It's just the three of us. But I remember going home and that's all you had was your family. Yeah. Or very close friends. And you just kind of got through it, and we just thought it would not end.
Yeah.
Like when it went past 1 year into 2 years and until but we're here now.
And I think it's nice to balance, like early on we were really focused on physical health, right? How do we protect ourselves from this infectious disease? And I think you could see people taking a different approach and really thinking about the mental health and what the impact was. And how do you build your resilience, right? Coming together. What are those things? Taking care of yourself, having talk therapy, having cognitive behavioral therapy, really doing some of the self-care, which I know is a buzzword, but is really important to building your own resilience and health and wellness. I mean, I love the conversation and the arc that's been happening as we come out of the physical health risk that was so high early in the pandemic.
What would you tell yourself now, your 18-year-old self? What would you tell that young woman just starting at this point now? Would it be anything different?
Keep pursuing your passion and be comfortable and stay true to yourself.
And that doesn't change.
No, it doesn't change.
Yeah.
I do. That's a good point, George. I think I had to tell myself that the other day.
I still have to tell myself that at 60. Do you know what I mean? Like, it's like you're it's constant self-help. It's constant writing for me, and that's what I got from therapy, was that I'm journaling every day and then going back to see if there's any progress, or, you know, if it's still there, or actually what it was that brought me to that place. And that's, we were talking about earlier, one of the reasons for the show, it's called insideSTYLE. And fashion is just a small component of style.
Absolutely. I 100% agree. And I would say, you know, I was like, why does George want me to be on this? I'm not very stylish. But I do think, like, you know, I was sort of like a nerd growing up.
But that is style, and that's...
But I was confident in it. I was okay with it.
Okay.
Do you know what I mean?
But that's your style.
And that was part of my style.
Yeah.
Like, I just am who I am. And when we talk about at our workplace, I really want my staff to come as they are. I want them to show up as they are, because that is their powerful self.
Okay.
Do you know what I mean? And, you know, I grew my hair natural a few years before the pandemic.
Okay.
And it was really tough. I mean, I'd been in different environments where looking a certain way mattered, but I needed to be healthy. I didn't think it was healthy to be chemically straightening my hair. And I wanted to be confident, and I wanted to be comfortable in who I was. So I was like, okay, I'm going to rock this. I'm going to go with it.
And you are.
Oh, thank you,
So you know, because we're winding down, but how did you find being a woman, an African-American woman, in leadership? Because this is Women's History Month.
Yeah.
How did you find navigating those waters? Was it something that you saw? Was it something you experienced? You know?
I think you see it all the time. And I would say, I feel like it creates an experience of hyper-visibility as well as invisibility. And on the one hand, you're aware that you're different. Everyone's looking at you, and you're not quite meeting the expectation no matter what. And, you know, I was raised, you have to be twice as good, you have to do all those things. But you also sort of learn, well, I'm really invisible to a lot of people. And I kind of try to turn that into my superpower, George. Okay, that helps me see people who they are, right? See that style beyond the clothes. See people beyond this outside image. I know we talk about it. That's important. I definitely put time and energy. But I think, like, creating the inner self, which radiates out, is so much more critical to me. And I try to see people on that level. And I think that's where my comfort, right, comes from.
Well, you know, this has been amazing. I want to thank you for taking the time out of your busy day to come and chat with us. You're going to definitely have to come back. Can we follow what's going on with Unity Healthcare on social media?
Yes, we definitely can.
Newsletter?
Yes. I know that we have a Twitter account. We have a Facebook account. We're on LinkedIn. I'm on LinkedIn. I'm happy for anyone to connect with me, and I love to share the work that we're doing quite regularly.
Oh, that's perfect. Well, you know, I'm all for it. I just believe that health and fashion can go hand in hand. Lifestyle, all of it, to make us that whole person. So again, thank you. Thank you for coming on. And you've been listening to insideSTYLE. We've had Dr. Jessica Boyd on. This is dcradio.gov 96.3 HD4. I'm your style person, George Worrell. Remember to be comfortable in your own skin. We'll see you next time. Thanks.
In DC, for DC. DC Radio, 96.3 HD4, and dcradio.gov.